Alright students, let us start the teeth. So in this video we are going to discuss some about the teeth, their histology and all that. So in your first image you can see here that that brush is done to some of your molar tooth. So spelling of a teeth is T E-E-T-H. So first let us see about the teeth. You can see here one kid is there and teeth are erupting. So you know what is a teeth. You already had listened in your everyday life about importance of your teeth, what your parents they tell you to brush your teeth at twice a day and all that. Like this they tell you to brush your teeth twice a day. Why they tell you to brush your teeth twice a day? Because if you do that you'll not have any sort of dental problems, and your teeth will be healthy when you come across at the age of 60 and 70. If your teeth are very strong, you can eat a good amount of food. Your oral structure, your cavity, your movement, how you speak and all that will be in a good impression, and the first thing your smile will be very important. So first let us see, unlike your heart, brain, the teeth also very they are ready to work every day. Okay, they're ready to work. Like see your heart, your heart or if your brain, if they're taking a rest of any day, it means totally your entire system will stop that day working. But it is not like that, because we are having the full day work by that of a teeth. So they're ready to work for you at any time, even from the time in the a child will take birth. From there onwards they're ready to work. Next, see, you can see here one small kid is brushing because his mother had told him it seems to brush that day, or else she will not give him a chocolate, and her mother has scolded him that because he ate the chocolates he will not give. So you can see this child is a very young age. So almost if the child see, in the child from the day one onwards the teeth eruption will start. Okay, and first eruption sequence of the teeth is known as deciduous teeth, and these deciduous teeth they will start coming around at 3 years of age only. Okay, when he comes around at 2 to 3 years old only, all the 20 teeth will be present in his mouth. You can see in this image, sidewise image, there are the central incisors, canine, and then molars. Here also you have central incisors, lateral incisors, canine, molars, and two molars, first molar and second molar, like the, and this is upper is a mandibular maxillary arch and lower is a mandibular arch. So this is one left quadrant, right left quadrant, and all that. So you please remember, in your deciduous teeth is also known as milk teeth or lacteal teeth or baby teeth. So these teeth will be present almost, there will be a 20 in all the, yes, there will be 20 in all, and they start living at age of 5 or 6 years. So if the child comes around 5 to 6 years, these teeth will start living out. So you can see here one kid in her teeth also, see there is a smeeze between her teeth. So this is your deciduous teeth, and already she is having the gap in her teeth, but still you can see that some teeth are erupting in her. So baby through which falls because it is what pushed out of the way by a permanent tooth, and slowly this permanent tooth will grow and it takes place of your baby teeth. So by a age of 14 years, so most of them will be lost, all of your baby teeth, and fully set off a permanent teeth, right? So there are the different types of a teeth. So what you are having, first we are having the incisors teeth. You can see these are the central incisors, lateral incisors. Incisors are very flat in shape and they have a sharp edges. That sharp edge known as incisor ridges. Okay, they help the food to bite and so this is an introductory lecture in which you will know what is a teeth, like that only we have some parts. Then we'll elaborate your course with even we have a textbook teachings as well as like this lecture teachings, which will like feel you that you are listening your lectures of your colleges. If you have missed any lecture, you can see your lectures also. They will be like your college lectures and bit better for that. So these are your canines. So canine teeth, they're a fang, like they're sharp, like shield shape like that. So they have a long fainted like structure and they can tear the food like meat and all that. So right, then we have a molar. So molar tooth, so these tooth they are present at the sides and a back of your mouth. Okay, they are known as posterior tooth. Okay, anterior tooth are incisors and canine. Why they are, see, incisors and canine, they are present the starting part of your mouth, so they are known as anterior tooth. Then you have premolars and molars. So you can see these are your premolars and this is your molar. How many molars are there? Three molars are will be present in your permanent dentition, first, second and third. And third molar, that is known as wisdom tooth, it will be absent in the deciduous teeth. And first and second premolar also will be absent in the milk or deciduous teeth. Okay, so these teeth will be not present. Then you can see here image of 32 teeth are present, and there is a tongue here, throat here, incisors, canines, premolars, molars and premolars, incisors, canines and molar. All these are already they are present. So you can see that the picture is showing 32 teeth, and here you see there are four incisors, canine, molars, premolars, all these are already present. Right, let us see inside view of the teeth. You can see the histology of this teeth. So firstly you can see there will be water. This is the crown. The whitish color is structure, the outermost portion, this is your gum. Okay, pink color covering is there, no, that is known as gum. So before to that gum only, what structure you are seeing, that is known as crown. Then you will have a root, the portion at we below to that, and it is covered by the gums. Then you are having the enamel, which is white color. Then about the dentine you are having, below to the dentine you are having the pulp layer, and sides of this crown, it is covered by the gum. Then you are having the cementum, that cementum is below and it is covering the root. Then you are having the jawbone, this is a white color jawbone. So we'll learn about it, all this in the oral histology very deep. Okay, so this is your enamel. Enamel is the outermost layer of your tooth. Right, it is the hardest and it is non-living and avascular structure. It is derived from the ectoderm. So this crown, it is hard and it is a protective sheet. So enamel is also having some structures like enamel rod, enamel tuft and all that. We'll discuss it later of your lectures of this year. Then you have a dentine, right? So dentine is also non-living and it is dark and it creates a bulk of a tooth, and it is more in the number and it is below to this, but it is softer than the enamel. It is not much hard than that of your enamel. Then you have a pulp. So pulp is a living tissue and it is having nervous supply and also the blood. So dentine is protects the innermost part of a tooth, that is a pulp. So if any diseases like cavities and whatsoever, if they are coming, if they will come and pass through the pulp and it causes the pain and all that. So these will be helping that not to happen. So when you eat very hot soup or cold ice creams and all that, you'll feel a pain is there. Okay, it's your teeth and all that. The nerve endings inside this, you can see to this one, you can see. So you please remember, you may remember, you know that listen, that tooth are non-living. If the tooth is non-living thing, it is having no function means, please tell me why you get a pain when any when your dentist is removing your teeth, when he is adapting when he is doing this extraction of your teeth, it creates a lot of pain, and blood loss also is there. Even if anemia patients, if there are loss of blood also there, more it creates a lot of pain for them. So it is all because of pulp, and pulp is having blood vessels, arteries, nerves. It is also having the plexus, nerves of a plexus and all that. So the pulp is very important so that your teeth is very healthy and all that. So you should prevent your pulp, and if any diseases, if any caries, if it crosses enamel, it's okay. Till that you should take any restoration, any treatments of endodontics, so that you create use some dental cement, so and you prevent your teeth. But if you are crossing that limit, it's your in your hand to get in the danger. Then let us see the cementum. So cementum, the both the dentine and the pulp, they go all the way down into the roof of the teeth. So they are present below the tooth, and that is known as cementum. And in your cementum, you have two types of cementum: acellular cementum and the cellular cementum, based on the development. Okay, so it is present in your jawbone. Let us see that image of the what you had already seen. This is a 32 teeth, permanent teeth structure. So you have in canines, premolars, molars, and all that. Along with that, you can see that incisors, they are cutting for the foot. Then you will see that the canine are also there for tearing of the foot. Then also the premolars, they are also for the grinding of food. So canine will tear the food, incisors will be cut the food, and premolars and molar, they grind the food for the digestion. Hoping that this had explained your concept, and let's thank you.